Well, hello everyone. This is Erica Spicer Mason with Becker's Healthcare. Thank you so much for joining us for today's fireside chat, Healthcare at a Crossroads, using concierge medicine to strengthen revenue, retention, and patient satisfaction. Before we get started today, I'm going to walk through just a few quick housekeeping items. First, today's webinar will be a fireside chat, and you can submit any questions that you have throughout the webinar by typing them into the Q&A box that you see on your screen. Today's session is also being recorded and it will be available after the event today. You can use the same link that you used to log into this webinar to access that recording. And finally, if at any time you have issues with your audio or visual, just try refreshing your browser, and you can also submit technical questions into that same Q&A box. We are here to help. And with that, I am pleased to welcome today's speaker. I'm so thrilled to say that we have with us Keith Elgart, the CEO of Concierge Choice Physicians. Keith, it is so great to have you with us today for this fireside chat. Welcome. Thank you for being here.
Thank you for having me participate today. This topic is a very timely one as healthcare systems and medical groups continue to face declining reimbursements from third-party payers, including government cuts to programs like Medicare and Medicaid. Combine that with the ever-increasing overhead costs, physician burnout and exit, ever-increasing challenges to patient satisfaction and competition from other systems and groups, and it really is like the perfect storm. And concierge medicine truly is a simple and straightforward way to address a lot of these pain points and create real positive and lasting impact.
Mm. Yeah, Keith, I'm so glad that you started to touch on some of those pain points because I do want to go a little bit deeper and talk about some of the pressures that you just mentioned. And before we do that, just wanted to give you a little bit of space too to tell our audience a little bit more about yourself, your role at Concierge Choice Physicians, whatever you think is important for folks to know as we go into the conversation today.
Sure. So my name's Keith Elgart. I'm the CEO at Concierge Choice Physicians. We've been a leading provider of concierge services to independent physicians, small groups, and large health systems for over 21 plus years. Thoroughly enjoy the work we do. I find great value in it, and our clients have as well. Always love to say that our first client 21 years ago is still our client today. So I think it's a testament to who we are, how we engage with our clients, and the value that this kind of service provides.
Oh, that's a great opener, Keith, and kudos to keeping that partner for 21 years strong. That's fantastic. So going back, Keith, to a little bit on some of the pressures that you were touching on, you mentioned reimbursement challenges, policy changes that providers and health systems are facing today. I'd like to know what are the most common pressures that you're hearing health systems describe, whether that's financially or from a workforce standpoint. Would love to know what you're hearing on the ground.
Sure. From a financial perspective, everything is becoming harder. Reimbursements from insurance and government programs are always a concern, and they're not created in a way to increase over time, right? Each year the reimbursement is lowered and threatened to be lowered even further. So you have a revenue structure based on constant decline. And then from a workforce standpoint, the pressure is equally as great. There's a tremendous need for patient care. You have that coupled with a physician shortage from high levels of retirement alongside a decrease in newly trained physicians. The current model can really burn out experienced physicians and discourage younger people from entering the field. And ultimately, the conversation always revolves around how to generate revenue from a different source and how do we retain experienced physicians and recruit new roles.
Yeah, so well said, Keith. Thank you. And I'm curious, I know Concierge Choice Physicians works with organizations of varying sizes and structures. So are you seeing differences in these pressures when it comes to health systems versus medical groups?
No, they all have kind of the same things, just on different scale, right? They all have the same responsibilities in the same manner. They all get the same rewards or punishments from the ecosystem they function within. And so, really they have similar problems. It's, again, just a matter of size and scope.
Yeah, absolutely. Well, appreciate the high level view, Keith. And I want to bring it now back to a little bit more about Concierge Choice's wheelhouse and what you all are doing in the concierge medicine space. We're hearing about more health systems explore these flexible concierge programs. So from your perspective, why do you think why is this conversation happening now? Why is it of higher interest to health systems?
Sure. No, the conversations are happening definitely at a higher frequency. Today's concierge models are really more flexible, and they're able to adapt to the business structure and goals of healthcare organizations that are serving a high number of patients in like a seamless, integrated way, right? This is why large medical groups and health organizations are our fastest growing client base over the past couple of years. Systems are really recognizing that patient demand exists, physician interest exists, and the ability to provide this type of service can be done in an efficient, effective, and profitable manner.
Yeah, interesting to hear you tying all these pieces together, including efficiency, the workforce perspective, and patient access too. So, would you say that the way that health systems are becoming more drawn to concierge programs, is it primarily about revenue enhancement? Is it more about physician retention, or are you finding that they're equally interested in improving both through this approach?
It's really, we call it like the trifecta, right? It's really about revenue, retention, recruitment, those as one, and then patient satisfaction, right? So it's really meeting the needs of those key three areas of survival and not only to survive but to thrive.
Yeah, absolutely. And, I'm sure folks listening in probably have varying ideas and degrees of understanding of what concierge medicine even is. So I'd love to just do a little bit of level setting on what this looks like in practice. As health system leaders are evaluating flexible concierge programs, what are the most important structural considerations that you think they should understand up front, especially when it comes to understanding how concierge programs fit within an existing business model?
Sure. Look, this touches on what we were just saying, right? There's a variety of models that we roll out with health systems, and they're adapted to meet their needs, right? This isn't about force-fitting the systems to change. It's about creating programs that fit the systems. And it's really making sure that all stakeholders, right, and like we said, that's the administration, the physicians, and the patients are satisfied with that outcome and the experience, right? Administration can see that increased revenue number. Physicians can have that more professional, that like higher level of professional satisfaction, and patients have more options available to them to meet their care goals, right? These flexible models really allow for systems to bring programs to life with no dramatic change to the existing business model. Doing this creates a scenario for much greater potential impact from that perspective of revenue, satisfaction, and engagement.
Right. And I guess I want to flip the question a little bit too and ask you if you could just describe for our audience what typically remains unchanged from an operational standpoint when a system does add this membership component.
Sure. So in that like hybrid or blended approach, most operational things like staffing, office space, all of that remains unchanged. It's not required. It's not necessary to hire new physicians to deliver concierge care or to build out swanky new offices. The program really operates within the existing structure of the practices. It's really about like going down to the patient perspective, right? Most patients who are interested in these kinds of programs, they want it from their physician, the physician they already know and they love, and at the convenient location and familiar office they already go to. They're not necessarily looking to change everything in their care. They want, different, more from the people they already like where they like to go.
Yeah. And that's so relatable too. We're all healthcare patients at the end of the day. And I can
Right.
say that I certainly wouldn't want to leave my primary care provider and some of my specialists. But if there were enhanced offerings, that's another story. So appreciate you clarifying that, Keith. I'm also curious how you educate executive teams about concierge programs. So how are you helping them think about physician participation, whether that's in primary care, specialty care, or even both?
Yeah, no, that's a very important question, right? Physician selection is key to the success of a concierge rollout, right? So, personally, as Concierge Choice Physicians, we provide an in-depth analysis that helps systems identify potential candidates, right? This, of course, needs to be paired with interest from the physicians themselves, since they're the ones that are delivering on the program offering. But that data analysis really gives some in-depth information to look at from a quantitative perspective where the greatest viability may exist. Then it's obviously deciding comfort for pilot programs and the strategy behind it, right? So some systems, let's say pilot with like a cohort of 5 or 6 PCPs in a single location, right? Others will include specialists like cardiologists or endocrinologists gastroenterologists, etc. But we've rolled out pilots of 2 physicians in a single office to pilots of 20 physicians in 20 separate locations across large states. It really depends on the system goal and timeline.
Yeah, that concept of flexibility really comes through in your response when you're talking about pilots with as few as 2 physicians to 20. It sounds like there's a lot of room to kind of adjust based on the fit for the system at hand.
Look, it's concierge, right? From a medical perspective, it's the idea of personalization to the patient, right?
Hmm.
Our responsibility is like personalization to the system and the clients, right? Everybody doesn't have the same goals, the same outcomes, the same pressures, and we can really customize all of this and personalize it to what their goal is and what their path
Yeah, really helpful to know. Thank you, Keith. Let's talk a little bit more about the financial side of things. I know we spoke about upfront how the financial piece is just up there with in importance with the workforce and the patient access piece, but yeah, I think we should focus on this just a little bit more. For leaders that are focused on financial sustainability, how does adding an optional membership component create an additional revenue stream without requiring this restructuring of the broader practice or
is.
system?
Yeah, I love this question because whenever I do talk with leaders at health systems about this, you get that kind of like oh, like it's that simple and straightforward in many ways. It's just like it just gets laid out that way. But hybrid concierge programs can be looked like simply as like an additional service option available to patients who want to pay a fee in addition to their utilization of insurance. Right? It's all net positive revenue, and realistically, small programs add up quickly. So if we just give like as an example, right? So a physician has, let's say, 50 concierge members and the membership fee is $2,000 per year. That's $100,000 in additional revenue for that practice, right? That patient's still using their insurance. They're not new patients to the practice, but it's $100,000, directly into that practice. And for many primary care practices, that's a significant increase, right? So now think about it instead of 1, think about it as being 10 physicians and you're crossing $1 million in revenue. And, we have health systems that have like 30 plus providers currently active doing this. So you do the math, right? That turns into a multi-million-dollar revenue stream just by a small tweak to how some patients in the practice are utilizing time and availability. But you could even take it one more step, right? Many hybrid programs don't have just 50 members. They have closer to 100 members. Mm-hmm. And many markets we work in don't charge $2,000 per year. They charge more than $2,000 a year. You could see like just how these simple programs turn primary care practices, which in a lot of health systems, unfortunately, can be seen as like feeders to specialty care in the hospital or just as loss leaders. And you could really turn them into profit centers on their own. Don't forget also, unlike traditional insurance, like program prices in concierge programs can be increased over time. So this is like a reimbursement rate that the system can actually control and can actually increase over time.
Really, really interesting examples. Thank you, Keith. And I assume you're having a lot of conversations with CFOs, and I think that the chief financial leadership role now probably has to be more scrutinizing than perhaps ever before at the health system level. And so what are the biggest concerns that you hear from them? And are you addressing those concerns with some of the examples you shared, or is it something else?
Yeah, so it's very funny. It's like the first step is always that, like, here's what it can generate. And the 2 questions almost every CFO in the conversations asks me right after are, what are the upfront costs to rolling this out, right? So great, I can make that, but what does it cost me to get there? And then what are the regulatory concerns to be aware of, right? So how do we do this in the construct of all of our requirements from a regulatory and compliance perspective?
Yeah, that's really, really helpful to hear. I'm sure a lot of folks listening in are probably asking those same questions. Is there anything that tends to surprise CFOs when you talk to them about upfront costs to start or even return on investment? Just curious.
Look, in response to those 2 things, right? I think they're most surprised about how the program launches in a way that truly can be risk-free for the health system, right? And when they partner with someone like us, for example, there's no upfront cost. There's no investment from the health system to get these off the ground. And they also tend to be very surprised with how easily these programs mesh from a compliance and regulatory perspective. Again, 21 plus years of doing this, navigating that has been done. And there's clear space for these to exist in conjunction with third-party payers, government programs like Medicare, et cetera.
Ah, so helpful to know. Thanks, Keith. And I know we touched quite a bit now on the revenue, the financial piece, but let's go ahead and talk a little bit more about the physician workforce.
Mm-hmm.
We know that physician satisfaction is increasingly tied to financial performance at hospitals and health systems.
Mm-hmm.
So would love to hear a little bit more about how participation in a flexible concierge program can actually affect physician engagement and also retention.
Sure. Look, physician burnout is one of the biggest problems healthcare organizations are facing. Right? And concierge medicine is a great way to combat burnout because it really allows a physician to practice a style of medicine they enjoy for some or all of their day, while still meeting or exceeding those financial and productivity requirements. Concierge medicine is really extending the career of the most experienced senior physicians who just cannot or do not want to practice at that required pace these days. Let's picture a senior physician who may be heading towards retirement, right? Many of them don't retire because they want to stop practicing medicine. They love medicine. They love their patients, right? They retire because they just don't want to do it under the current pressures and demands. They've worked long and hard. They've established these amazing relationships with their patients, and they wish they could just change the pace a little bit while still delivering on their employment responsibilities. A concierge offering for them gives them a sense of pride and accomplishment. It's like the feeling of getting a promotion. Right, most physicians, there's no promotion from being a physician. It's you do it for the love of the labor of what you're doing. But this really incentivizes them to stick around, help out, help the system combat the brain drain that happens when you lose your most experienced physicians. And I like to always share some stories. So I have a quick story that illustrates this. We have a senior physician in a large medical group we work with. And he was contemplating retirement for a while. He just didn't want to work at the ever increasing pace. And so with that group, this medical group, we structured this scenario. This senior physician, needed to slow down the pace, right? So he reduced his panel from about 2,000 patients to 500 members. And look, just mathematically, those 500 members, he's generating $1.5 million in revenue in his primary care practice from that. Right. So in this group setting, though, those 1,500 patients or so that didn't join his program, that weren't interested in concierge at this time, didn't need it, it wasn't for them. They stayed within the medical group. And what was great from the medical group's perspective is these patients filled in the panels of the other newer physicians in the group. And so those physicians immediately increased their productivity and their value. Right. They started delivering on those numbers. The ramp up for the size of their practice increased immediately. So not only did this increase the revenue and satisfy those productivity goals, the senior physician, this guy, I love him, he's great. He's acting as a mentor to all these younger physicians. So he's got the time, he's got the energy for it. And so now he's in a role where he can impart all that experience and knowledge he has, right? Again, combating that brain drain. He didn't just leave with everything he learned over the decades of his career. And what's great about this, in addition, is he set the model for others in the group to see what that path can look like. And over the past few years, we've done the similar kind of transition with other senior physicians in the group in the same exact manner. Now, most of them had hybrid programs already, which is wonderful. That's how this group worked. Everyone had hybrids. But when they reached a certain phase, they were able to do this transition to the full model. And it's just played out beautifully for them.
It's such a illustrative example, Keith, of the ripple effect that you're touching on, how one physician changing the way that they're not changing the way that they're practicing, but changing how their patient panel is looking and the operations behind that and how it also affects other physicians in a positive way. So appreciate the example. So it really sounds like retention is a big piece of this, but also I'm curious about recruitment. So if a medical group or a health system is participating in flexible concierge programs, are you seeing that draw in other physicians as well? And if so, what does that look like?
Yeah. Look, listen, for recruitment, a concierge offering becomes a very clear differentiator between, let's say, your system and other medical groups and organizations in these competitive markets. Right? Many of our clients have heard from candidates when they're doing interviews that this type of opportunity being available as part of the career path for them is the reason why they're choosing Group A over Group B. It's a clear look at like a vision for the future for them, right? It's when people ask you, where do you think you're going to be in 5 years? And when like a person being interviewed asks, where do you see the company in 5 years? This is like the clear answer. It's not, we see you seeing more patients per hour every hour, and every year we'll just try and add more to that and see what we could squeeze in. And of course, I have another quick story for this one as well. I love to share stories. But we have a very prominent health system we work with in a very, very competitive market. They're constantly recruiting against the other organizations, but they all have, a very similar offering for the potential new hires. And those new hires might be folks out of residency, might be the independent practices that are kind of looking to sell into a system or affiliate. And then also just those, I call them like free agents, the ones who have contracts that are expiring with other competitive health systems that are now seeing what they want to do next. The key administrator at this health system we work with, his responsibility is increasing the primary care business. That's it, right? That's his marching order. And he successfully recruited a number of physicians. This scenario I'm thinking about specifically is kind of like a group of senior physicians, like that free agent kind of pairing. And he was able to recruit them because, they allowed and promoted concierge as an opportunity. All the other factors between the places these doctors were considering, salaries are about the same, benefits are about the same. The reputations of the organizations were on par, The unique factor was literally the ability to offer concierge within this system, and that was why these doctors joined that organization. And I've heard from these three doctors, and that literally they sat down and said, "This is why I chose them."
Yeah. Yeah, really interesting and sounds like competitive differentiation for sure is what you're speaking to. And I know, Keith, you mentioned you really like telling stories about what you're hearing on the ground from physicians, from organizations. So I'm curious too, from these providers that you're seeing either join an organization because they're offering flexible concierge programs or they're already engaged in one of the programs, what kind of feedback are you hearing directly from the physicians?
Positive. That's positive. Look, the physicians at the baseline, at the heart of it, love the engagement with their patients, right? The problem isn't engaging with their patients. The problem is feeling like they don't have enough time to engage with the patients, right? That something's been lost in the translation of how medical care is delivered. And so whether it's a hybrid or in full model, they get to kind of reclaim that as part of who they are and why they're practicing. And it really just, look, it's not for everybody. Not every patient wants it, desires it, needs it. But for those that want it, being able to deliver that it's fulfilling, it's satisfying, it is career satisfaction, right? It is going home at the end of the day and feeling accomplished.
Yeah, thank you so much for elaborating on that. And Keith, I know we already talked a little bit about how concierge programs can fit in the primary care space as well as specialty care. But I just want to get a little bit more detail on that point specifically. I think some folks might assume that concierge programs are still limited to primary care.
Mm-hmm.
So, how are you seeing specialists participate in the flexible models within larger organizations?
Yeah, no, that's a great question because many conversations I have always circle around primary care and specialty care. They're like, wait, really? Wait, that's possible? And I was like, we've had specialists with us again for like almost 21 years. The key is really that the physician has a strong ongoing relationship with the patient, right? As long as that exists, a specialist can be very successful in concierge medicine. It works well with specialists who are providing non-episodic care, right? So if you think about cardiology, endocrinology, gastroenterology, gynecology, more areas of non-episodic care. Patients who see those specialists more than just for like a procedure or like a one-off annual check-in each year, they view that specialist as their quarterback. Like that's the quarterback to their care. And that relationship is where success in concierge with specialists really occurs. If you think about folks who see a cardiologist on a regular basis, even in the winter when they're not feeling well, they have a cold and they want a Z-Pak, they're checking with their cardiologist to make sure it's not in conflict with other medications, that it's not something more dramatic. That specialist in those, modes of care become really that central hub for that patient.
Yeah, so insightful. Thank you, Keith. And I know we've touched so much on how concierge programs fit into organizations more broadly, their impact on the workforce. So I think it's important for us to also touch on patients as well and how
Yeah,
this all contributes to patient experience. So, from your point of view, how does offering membership as an option rather than a replacement of care, of course, how does that
mhm,
support satisfaction and continuity for patients? And can you share any examples of that?
sure. Look, patients have a variety of needs at different stages in their healthcare journeys, right? Some barely see their PCP, right? They go to urgent care as needed. Maybe they schedule an annual appointment if they get around to it. And if they do it, like their annual physical, they'll just take the next available appointment. Like it's not even about who's doing it. Um, but others have very specific, long-standing relationships with their physician and rely heavily on their knowledge and their expertise, right? And then there's everything kind of in between that systems have in place for that spectrum, right? You have virtual visits, you have care teams, extenders, and all sorts of other modes. But the key is really providing the variety to meet everyone's needs, right? The hybrid approach to concierge really provides the physician an ability to meet that variety of needs within their patient panel, right? Dedicating a small portion of the day to concierge with a vast majority of the day intact for traditional patients really allows for that proper balance. For those patients who want a concierge style engagement with the physician they know, as I said earlier, right? With the physician they know at the location they like to go to for care, it's a win for them, right? They don't have to see a different physician. They don't have to go to another location. They don't have to change all of that to get concierge care.
Mm.
Um, and the beauty also is like with the hybrid approach, the option's always available for a current non-member to join at a later date if their healthcare needs change. And on the flip side, it's very comforting for an existing member to know if they needed or wanted to revert back to the traditional side of the practice that they can, right? They don't have to leave to go to a new doctor at a new place and then, God forbid, let's say, lose their job or have something that just changes where concierge just isn't for them at this time. They don't have to go walk it back to another location again to another doctor. They can have this this fluidity and this flexibility within the practice. It really ensures that continuity exists for all patients.
Yeah.
We've seen in our data like higher satisfaction scores in hybrid practices, not only from members, not only member satisfaction, but also from non-members. It's sometimes I mix up sayings, but I think the saying is like a rising tide raises all boats, right? The
Yeah.
positive aspects from the offering extend to everybody in the practice. This isn't like a turn the switch on and off for people. It really, the experience is enhanced for everybody, whether they're a member or not.
Mm. Yeah, and Keith, something you were saying earlier, you were speaking to how there's flexibility on the patient side where if they'd like to join a membership model later on, they can. And if they'd like
Mhm.
to, cut ties with it, that's an option as well. So optionality sounds like it's an important theme here. Why is the element of choice so important for patients right now?
Yeah, look, it's that's the way the world is, right? There's a lot of variety. There's not a lot of exclusivity in things. There's lots of competition, especially in healthcare, right? It's you know, fortunately, not for, unfortunately, however you want to look at it, there's a business aspect to it, and so it becomes highly competitive. And from a patient perspective, they want to feel in control. They want to make decisions for the things that feel best for them, especially when it comes to their health, right? That's important. Again, like we said, some folks, I have family members, right? They just drop into urgent care when they don't even know who their primary care doctor is assigned to them through their insurance. No idea. They never go. It doesn't matter, right? It doesn't matter till it matters. And then I have other family members that I know that have long-standing relationships and that are concierge members at doctors in other parts of the country. Um, and I look at it and I see with just within my own family, I'm like, oh, there's a spectrum of needs, right? There's people all across the spectrum that utilize the care differently, and making that available is important. And they can all choose, and they can choose from within the same structure, right? When everybody was living at home with me, my kids, everybody, we were all within one health system, but we used it in very different ways.
It's a great example, and it leads me to what I wanted to ask next is, Keith, you've shared so many great examples of physicians and their feedback on what they're seeing as benefits of concierge. What are patients responding to most outside of just, this idea of choice alone? Are there particular elements of concierge programs that are especially compelling for them?
For most patients, It's really just about the what if I have an emergency, right? It's that I have somebody who knows me and my health history directly, and God forbid something changes, I have like my go-to person, right? Again, for a lot of people, the concierge really comes in strongly when you're a little bit older, you're juggling one or more health issues. When you think about health and wellness, you're thinking about it from a medical perspective, about longevity, right? About being around for my grandkids, all those things that come into play, right? When you're young, when you're in your 30s and even your 40s, you think about health and wellness and membership. A lot of times you're thinking about whatever the new trendy gym or workout thing is, right? Getting a personal trainer. Like, I don't feel well, I'm going to go lift more weights and I'm going to go run on the treadmill somewhere. But there's a certain, in the point where you just kind of flip and you're like, this feels a little more internal. This feels a little more medical. I think about it in that realm. And so from a patient perspective, right, that has increased over time, that desire, kind of as some of that personalized aspect has been stripped away in one way or another. It's kind of there's that resurgence and that look for it. We're seeing membership increase dramatically year over year. We're seeing participation from physicians increase dramatically year over year. I think it just becomes part of the expectation of how patients can get satisfaction that they are doing right, taking care of themselves and how they eat and how they, their sleep habits, their eating habits, their physical habits. It's kind of all tied together these days.
Mm. And it really aligns with what we're seeing and hearing at Becker's as well in our conversations with health system and hospital leadership. Patients are expecting more than ever before from their care. So a lot of the trends that you're highlighting here certainly make sense, Keith. And I know we've
Mhm.
covered a lot of ground in our conversation already. We've talked about the financial component, we've talked about the physician component, we've touched on patient experience and engagement. I'd like to now get a kind of a future forward-looking view from you. As you look to the next few years, maybe even a decade out, where do you see flexible concierge programs really fitting into the long-term strategy of integrated healthcare organizations?
Sure. Look, healthcare organizations are going to continue to face all these enormous financial and staffing challenges. The need and desire to focus on continuous improvement for patient satisfaction scores. All of those things aren't changing anytime soon, right? Revenue is getting tied to patient satisfaction. All these things then generate to the ability to hire, to staff, to retain. Meeting the needs of all those stakeholders, like we've said repeatedly, the administration, the physician, and the patients, can be addressed in part and potentially a large part through the offering of concierge options. Right? These options generate much needed revenue. They improve the physician satisfaction, leading to the higher levels of retention, successful recruitment, as well as just improving patient satisfaction by expanding the variety of options available to meet their needs. Like, all that stuff we touched on in all these questions really boils down to, financially, fiscally sound systems with happy providers and satisfied patients.
Yeah, thank you, Keith. And I know we kind of bring things back to the beginning of our conversation. We talked about how concierge programs are becoming much more popular across health systems. But for that healthcare executive who's curious, hasn't yet made the leap, they're feeling a little bit cautious, what would you say, and what's the first step that you would suggest to move in that direction?
Simply reach out to me, right? Almost every first conversation I have is like, we've been talking about this, or someone brought it up, but we're really not sure where to go, or we started down this path and then we weren't sure, we hit like a wall, we weren't sure, we paused before taking the leap. So I really, the simplest way, I always suggest explore a pilot program, with an experienced partner like us. We bring that expertise to this niche offering, right? There's some niche, there's some uniqueness. It's not as straightforward as many may think, right? So we have medical groups and large health systems who have rolled out pilots with like 6 providers that are now at like 30 plus providers. And like I've mentioned, we had others that rolled out with like 20 providers, and they continue to add new providers constantly. And then we have others who, again, just piloted with 1 or 2 providers to test the waters, and they're kind of in that phase right now. I have a few that just launched recently that they're testing the waters. But there's no reason to not test a small cohort of these physicians, especially with a hybrid or a blended model. Those programs are truly risk-free. No patients are dismissed from the practice. There's no change to the practice structure. We, like as our organization, when we work with these health systems, we shoulder all of that initial startup cost. We provide you the in-depth analysis based on those 21 plus years of research, and help you make those decisions on who, where, and how to roll out these programs. And again, story-wise, have a great medical group that we've worked with for like well over a decade now. Again, started with one physician offering a hybrid program. Others in her organization, they noticed, they're like, why is she generating so much more revenue than everyone else? Right? They didn't see it. And, and kind of finally taking a look at that, it led to more physicians offering those hybrid programs. Another client always says to us, like, success gets attention from your peers, right? He's doing this, he's out there, people see what he's doing. And so we have others within his group. We have his fellow physician friends all engaged with us in different ways because he did this, it was successful. You can see it in his attitude, in his, how he dresses now, maybe from a financial perspective, but really from his attitude, from his satisfaction and his happiness in delivering care. He's just back to who he used to be. So in more recent years, like in that medical group, as the physicians have aged, many of them are now senior physicians. And again, this goes back to that other example, because we do this in many places. Many of the senior physicians are now doing kind of that full model. Every other provider is offering hybrid, aside from a few who are actually scheduled to launch in the next 12 to 24 months. So basically, everybody is going to be offering concierge in some manner in this group because everyone's unique patient panel has some portion that is interested in it from their provider, right? This wasn't about creating one centralized concierge doctor and pushing everyone to it. It was like decentralizing it, bringing it to the patients where they are. And ultimately, this group and others that we work with, they're doing it on scale because the math works. The patient satisfaction has skyrocketed, physician retention and recruitment results are top notch. And again, the math just maths.
The math just maths. Love that. Keith, it's been such a pleasure learning from you today about concierge programs, what you're seeing, the impact that you're seeing on the workforce, organizations, patients, physician satisfaction and the care that they're delivering. It's been really great to hear, especially all the stories that you've shared. So I want to thank you for sharing those. Is there anything that we haven't touched on that you think is really important for our audience to know, or maybe something we glossed over too quickly? Would love to hear from you.
So I had a conversation with a health system 2 weeks ago, and they were apologizing for this aspect that I'm going to touch on. But sometimes launching a program, in a health, it can be a very slow process. And they were like, "Look, this is our initial conversation. We have so many people we have to bring to the table." I said, "Of course. There's no pressure from our side. Like, it can take a long time to get all the stakeholders on board." Sometimes, and with this group, we were laughing because the challenge was purely just getting available time slots on the calendar where people could meet, right? There's interest in this, but everyone's calendars are just booked, right? So, we could schedule a meeting 4 weeks from now, 6 weeks from now, right? Just to get to the second conversation where they could have everybody. But, I joke, it's often like, it's like turning like a giant tanker, like a giant ship, right? Really challenging, really slow moving to get there. But once that ship is pointed in the right direction, it's like full steam ahead, right? And so, my staff laughs when I make these puns, but it's like, I urge you not to miss that boat. But really, it might take a while to get pointed in the right direction, but if you do it right, methodically, with data that supports it, with the right partner assisting in the process, once you get that ship pointed in the right direction and everyone on board, it just moves. And again, with that, I just, be careful. Right? Be careful when you get started. There's so many nuanced aspects to an offering like this that can impact the success. Again, I urge you to work with Concierge Choice Physicians or other experts in the field in the process, because getting it right the first time really is the key to long-term success.
Well, appreciate the advice, Keith, and for everything that you've shared with our audience today. It's been very educational for me as a moderator, so I imagine very educational for those listening in as well. Just thank you again for spending time with Becker's today.
I appreciate the time to speak about this. it's a topic I love to discuss, happy to discuss over and over again.
Oh, well, fantastic. We hope to have you back, Keith. And of course, we'd also like to thank Concierge Choice Physicians for sponsoring the session today. Audience members, it's been great having you with us. Thank you for joining, and we hope to see you at another Becker's event soon. Thank you so much.